In the realm of antipsychotic therapy for schizophrenia, clozapine stands out as a game changer. Its unique mechanism of action sets it apart from other medications in its class, offering hope and relief to those who have not responded well to traditional treatments. Unlike other antipsychotics that primarily target dopamine receptors, clozapine has a broader spectrum of action, affecting multiple neurotransmitters, such as serotonin, norepinephrine, and histamine. This multifaceted approach gives clozapine the ability to effectively manage the symptoms of schizophrenia that are often resistant to other medications. By modulating neurotransmitter activity, clozapine not only reduces the positive symptoms of schizophrenia, such as hallucinations and delusions, but also provides relief from negative symptoms, including social withdrawal and apathy. Furthermore, clozapine's mechanism of action is associated with reduced risk of extrapyramidal side effects, commonly experienced with traditional antipsychotics, resulting in improved treatment adherence and quality of life for patients. With its remarkable efficacy and unique mechanism of action, clozapine has revolutionized antipsychotic therapy, giving hope to those who previously had limited treatment options. Understanding the mechanism of action of clozapine. Clozapine's mechanism of action is complex and not fully understood. However, research has shed light on its primary modes of action. Unlike typical antipsychotics, which primarily target dopamine receptors, clozapine acts on multiple neurotransmitter systems simultaneously. One significant aspect of clozapine's mechanism of action is its potent antagonism of dopamine D2 receptors. By blocking these receptors, clozapine reduces the hyperactivity of the dopaminergic system, which is thought to contribute to the positive symptoms of schizophrenia. This action helps alleviate hallucinations and delusions, providing relief to patients. In addition to its effect on dopamine receptors, clozapine also acts as an antagonist at serotonin 5-HT2A receptors. This action is believed to contribute to its efficacy in managing both positive and negative symptoms of schizophrenia. By modulating serotonin activity, clozapine helps restore the balance of neurotransmitters involved in the pathophysiology of the disorder. Moreover, clozapine has an affinity for alpha-adrenergic, histamine H1, and muscarinic receptors. These interactions contribute to its unique pharmacological profile and may explain its ability to manage symptoms that are often resistant to other antipsychotics. How clozapine differs from other antipsychotic medications. Clozapine's distinct mechanism of action sets it apart from other antipsychotic medications. While traditional antipsychotics primarily target dopamine receptors, clozapine's broader spectrum of action allows it to affect multiple neurotransmitters involved in schizophrenia. This key difference is significant because it means that clozapine can effectively manage not only the positive symptoms of schizophrenia but also the negative symptoms that often persist even with treatment. Traditional antipsychotics may only provide relief from hallucinations and delusions, leaving patients with social withdrawal and apathy untreated. Furthermore, unlike other antipsychotics that can cause extrapyramidal side effects such as Parkinsonism, dystonia, and akathisia, clozapine has a reduced risk of these adverse effects. This is due to its unique pharmacological profile and its lower affinity for dopamine D2 receptors compared to other antipsychotics. As a result, patients on clozapine are more likely to adhere to treatment, leading to improved outcomes and overall quality of life. The role of dopamine receptors in schizophrenia and how clozapine affects them. Dopamine receptors play a crucial role in the pathophysiology of schizophrenia. It is believed that an overactivity of dopamine in certain regions of the brain, particularly the mesolimbic pathway, contributes to the positive symptoms of the disorder. Clozapine's mechanism of action includes potent antagonism of dopamine D2 receptors. By blocking these receptors, clozapine reduces the hyperactivity of the dopaminergic system, leading to a decrease in hallucinations and delusions. It is important to note that while clozapine has a high affinity for dopamine D2 receptors, it has a lower affinity compared to other antipsychotics. This lower affinity is thought to be one of the reasons why clozapine has a reduced risk of extrapyramidal side effects. By selectively blocking dopamine receptors, clozapine provides relief from symptoms without causing significant motor disturbances. The impact of clozapine on other neurotransmitters involved in schizophrenia. In addition to its action on dopamine receptors, clozapine also affects other neurotransmitters involved in schizophrenia, such as serotonin, norepinephrine, and histamine. Clozapine's antagonism of serotonin 5-HT2A receptors is believed to contribute to its efficacy in managing both positive and negative symptoms of schizophrenia. By modulating serotonin activity, Clozapine helps restore the balance of neurotransmitters and improve overall symptomatology. Furthermore, clozapine's interaction with alpha-adrenergic, histamine H1, and muscarinic receptors adds to its unique pharmacological profile. These interactions may contribute to its ability to manage symptoms that are often resistant to other antipsychotics, providing relief to patients who have not responded well to traditional treatments. The benefits of clozapine in improving treatment outcomes for refractory schizophrenia. One of the most significant benefits of clozapine is its efficacy in managing refractory schizophrenia. Refractory schizophrenia refers to cases where patients do not respond adequately to traditional antipsychotic medications. Clozapine's unique mechanism of action, which includes its broad spectrum of activity on multiple neurotransmitters, makes it particularly effective in these cases. By targeting various neurotransmitter systems and modulating their activity, clozapine can provide relief from symptoms that have been resistant to other treatments. Studies have shown that clozapine is more effective than other antipsychotics in reducing positive symptoms, such as hallucinations and delusions, in refractory schizophrenia. Additionally, it has been found to improve negative symptoms, including social withdrawal and apathy, which are often more challenging to treat. The improved treatment outcomes associated with clozapine therapy can significantly enhance the quality of life for patients with refractory schizophrenia. By providing relief from symptoms that previously seemed untreatable, clozapine offers hope and a chance for a better future. Potential side effects and monitoring considerations for clozapine therapy. While clozapine has shown remarkable efficacy in managing refractory schizophrenia, it is not without potential side effects. It is essential for healthcare providers to carefully monitor patients on clozapine therapy to ensure safety and optimize treatment outcomes. One of the most significant concerns with clozapine therapy is its association with agranulocytosis, a potentially life-threatening condition characterized by a severe decrease in white blood cell count. Regular blood monitoring is necessary to detect any early signs of agranulocytosis, and treatment should be promptly adjusted or discontinued if necessary. Other potential side effects of clozapine include weight gain, sedation, hypersalivation, constipation, and metabolic changes. Regular monitoring of weight, blood pressure, heart rate, and metabolic parameters is recommended to manage these side effects and minimize their impact on patients. Additionally, clozapine carries a black box warning for myocarditis and cardiomyopathy. Although rare, these cardiac adverse effects can be serious. Regular cardiac monitoring is essential to detect any signs of cardiovascular complications early and take appropriate actions. Overall, the potential side effects of clozapine should be carefully considered and monitored, but they should not overshadow its remarkable efficacy in managing refractory schizophrenia. With proper monitoring and management, the benefits of clozapine therapy can outweigh the risks for many patients. Clozapine dosage and administration guidelines. Clozapine is typically initiated at a low dose and gradually titrated to an effective therapeutic dose. The dosage may vary depending on individual factors, such as the severity of symptoms and tolerability. In most cases, the initial dose ranges from 12.5 to 25 mg per day, taken orally in divided doses. The dose is then gradually increased over several weeks to reach the target therapeutic dose, which usually ranges from 200 to 450 mg per day. Regular monitoring of symptoms, side effects, and blood parameters is necessary during the titration phase and throughout the course of clozapine therapy. This allows healthcare providers to adjust the dose as needed and ensure optimal treatment outcomes. It is important to note that clozapine is available only through a restricted distribution system due to its potential side effects. It is typically prescribed under a clozapine risk evaluation and mitigation strategy (REMS) program, which ensures appropriate monitoring and management of potential risks. Current research and future directions in clozapine therapy for schizophrenia. While clozapine has been a game changer in the treatment of refractory schizophrenia, ongoing research aims to further improve its efficacy and safety. One area of research focuses on identifying biomarkers that can predict response to clozapine therapy. By identifying specific genetic, neuroimaging, or clinical markers, healthcare providers may be able to better select patients who are most likely to benefit from clozapine. This personalized approach could improve treatment outcomes and reduce the risk of unnecessary side effects. Another area of interest is the development of novel medications that target the same neurotransmitter systems as clozapine but with improved tolerability. While clozapine is highly effective, its side effect profile can limit its use. New medications with a similar mechanism of action but fewer side effects could offer additional treatment options for patients with refractory schizophrenia. Furthermore, research is ongoing to explore the potential of clozapine in other psychiatric disorders, such as bipolar disorder and treatment-resistant depression. Preliminary findings suggest that clozapine may have efficacy in these conditions, further expanding its therapeutic potential. Overall, current research and future directions in clozapine therapy hold promise for further improving treatment outcomes and expanding its applications beyond refractory schizophrenia. Conclusion: the importance of clozapine in enhancing antipsychotic therapy for schizophrenia. Clozapine's mechanism of action, which includes its broad spectrum of activity on multiple neurotransmitters, sets it apart from other antipsychotic medications. Its efficacy in managing both positive and negative symptoms of schizophrenia, along with its reduced risk of extrapyramidal side effects, makes it a game changer in the field of antipsychotic therapy. By targeting dopamine, serotonin, norepinephrine, histamine, and other neurotransmitter systems, clozapine can provide relief to patients who have not responded well to traditional treatments. Its unique pharmacological profile and ability to manage refractory schizophrenia offer hope and a chance for a better quality of life. While clozapine is not without potential side effects, with careful monitoring and management, its benefits can outweigh the risks for many patients. Ongoing research aims to further improve the efficacy and safety of clozapine therapy, opening up possibilities for personalized approaches and novel medications. In conclusion, clozapine's mechanism of action has revolutionized antipsychotic therapy, giving hope to those who previously had limited treatment options. Its unique ability to affect multiple neurotransmitters and manage refractory schizophrenia make it an invaluable tool in the treatment of this complex disorder.